Hello there, my name's Vicky and today I'm here to talk to you about induction of labour. Induction of labour is the process of starting labour artificially, where it is thought to be safer for mum and baby that labour takes place sooner than expected. There can be so many reasons for induction of labour. Usually these reasons are either maternal, such as high blood pressure, diabetes, preeclampsia, or perhaps your waters have broken and there's no signs of labour. Or perhaps it's a fetal reason for induction of labour. This can include reduced growth, reduced movements, or post-dates pregnancy. Induction of labour can happen at many different gestations, perhaps your preterm or perhaps your post-dates. Whatever the gestation, it's very important to have a discussion with your midwife or your consultant about induction of labour, having a discussion about the risks, the benefits, and also the alternatives. Before going any further, let's talk about the cervix. When you're non-pregnant or you're not preparing for birth, your cervix is generally long, hard, closed, and facing the back of your pelvis. During the later stages of pregnancy, towards labour, and during induction, the cervix goes through a series of changes called ripening. During ripening, your cervix starts to soften, it starts to shorten, and it starts to face the front of the pelvis, ready for dilation. Naturally, this stage is called the first stage, and this takes place over many days. Sometimes you'll feel cramps, and then other times they'll go away. Some methods of induction encourage this ripening process, but don't necessarily bring about labour. Sometimes, if your body is already ready or thinking about the labour process, then we find that sometimes these methods tip you over into labour. Let's move on to methods of induction of labour. The first method is a membrane sweep. This is where the midwife or a doctor will do a vaginal examination and they'll gently insert their fingers into the cervix to separate the membranes around baby's head from the walls of the cervix. This process stimulates the release of the hormones that can ripen the cervix, and it can also send you into labour. It's common for this procedure to be uncomfortable, it's common for you to have cramps and possibly some discharge after. This can be done at home, at clinic, or in the hospital. The next method of induction is the balloon catheter. If suitable, you may go in for a balloon induction. This is where a midwife or a doctor will give you a vaginal examination and insert a small catheter with balloons attached into the cervix. These balloons are then inflated to squash the cervix together in order to stimulate the release of these hormones that might kickstart the ripening process and manually dilate the cervix. This is a balloon. This end is where we inflate using these threads. This is the balloon inflated. Your cervix will sit between these balloons and be squashed together in order to release these hormones. It is common to feel some discomfort when this balloon is in place, and this usually settles, but pain relief will be provided. Usually, women will go home for 12 to 24 hours with the balloon in place before returning if labour has not started in this time. If the balloon falls out, then that's a good thing. It shows us that the cervix is starting to change. If labour has not started and the balloon has not fallen out, then you have to go to hospital to have the balloon removed. In this case, the doctor or midwife will try to break your waters using a small hook in order to try and start labour. If unsuitable for a balloon induction, we may opt for a PROPES induction. PROPES is an artificial hormonal method of induction where the midwife does a vaginal examination and inserts a small tampon-like pessary next to the cervix and leaves it there to expand. This is PROPES. This pessary contains prostaglandins, a hormone that interacts with the cervix and encourages this ripening process. It stays in for around 12 to 24 hours and you and your baby will be monitored in hospital during this time. It is common to feel discomfort during this time and a range of pain relief will be available to you. Labour may start during this process, or if not, it will be removed after the time and you will be waiting for your waters to be broken in our labour ward. To continue on with the induction of labour process, we might decide it's time to break your waters. We hope that this will trigger the release of prostaglandins to kickstart labour. During a vaginal examination, the midwife will insert a small hook and try to pierce the side of the water bag, allowing all the baby's waters to come away. After this, we advise that you mobilise so that we can await signs that your body may be starting to labour. If there is no sign of labour after your waters have broken, then we will move on to the next step of induction, which is an oxytocin hormone infusion. This is where there is a drip in your hand or your arm that contains a man-made version of the hormones that you produce in labour. This is slowly built up until you are in established labour, and this continues until you birth your baby. You and your baby will be monitored very closely during this process. Pain is a very individual and personal experience. Some of us find that we cope well with pain, and others find that we don't cope well at all. Rest assured, wherever you are, whether that's at home or in hospital, we want to work with you to help you feel as comfortable as possible. The whole process of induction of labour takes longer than that of a labour that starts itself. During a normal labour, your body has time to prepare its natural pain-killing hormones, but with induction, your body hasn't produced these, so some women find that induction of labour is more uncomfortable. Your midwife will be there to support you through this time and to guide you through different methods of pain relief, depending on what stage of labour you're at. In the earlier stages of labour, you might find mobilising, using a birthing ball, breathing, and using baths very helpful. If needed, you can have paracetamol, cocodamol, and even tramadol if you're struggling. Remember, the first stage in labour can take quite some time, so feel free to use pain relief where you need it. Once your labour is established, you will move on to either the labour suite or a midwifery unit, and there the full range of pain relief options will be available to you, starting from Entonox, moving on to diamorphine, and then on to epidural, depending on where you are. So that's it, we've reached the end of this video, and I just want to share with you my top tips for induction of labour. Relax! The process of labour heavily relies on your love hormones flowing and your fear hormones switching off. So wherever you are, try your best to feel relaxed and comfortable. Chuck on a DVD, have a laugh with your partner. It really pays off to be relaxed. Feed yourself! We've talked about how early labour can take a long time, so make sure you eat small amounts and you drink plenty during this time. A body that is dehydrated and tired doesn't labour effectively. Keep active! During early stages of labour, mobilisation and keeping active is good for both pain relief and for helping baby's head come right down into the pelvis, pressing on that cervix to release all your hormones. So get moving. Have a nap! Labour is like a personal marathon and your body is working so hard. So take time to rest so that your body can feel rejuvenated to keep going with labour. That's it for today. I hope you've enjoyed this video on induction of labour. If you have any questions, then please ask your midwife or your consultant. Bye bye!